Welcome and thank you for participating in today's technical briefing on the National Advisory Committee on Immunizations, or NACI's guidance for the Janssen COVID-19 vaccine. Bienvenue au briefing technique sur les conseils du Comité consultatif national de l'immunisation pour le vaccin contre la COVID-19 de Janssen. Today we will hear remarks from NACI's Vice Chair and Chair, Drs. Shelley Deeks and Caroline Quash. Dr. Howard New, as well as Matthew Tunis from the Public Health Agency of Canada, will also be available to answer questions during the Q&A session. Aujourd'hui, nous entendrons les allocutions des Dr. Shelley Deeks et de Caroline Quash du Comité consultatif national sur l'immunisation, de Dr. Howard New ainsi que Matthew Tunis de l'Agence de la santé publique du Canada seront disponibles pour répondre aux questions lors de la séance de questions et réponses. Note that the content of today's briefing is for attribution. If you wish to ask a question, please press *1 on your phone. Veuillez noter que le contenu de la session d'aujourd'hui est pour attribution. Si vous désirez poser une question, veuillez appuyer sur étoile 1. We'll now begin today's technical briefing. Over to you, Dr. Deeks.
Thank you very much. And good afternoon, everybody. Dr. Quashten and I are pleased to be here to present two key updates to NACI's guidance on the use of COVID-19 vaccines in Canada. As a quick reminder, NACI is an independent committee of experts that provide evidence-based advice on the use of vaccines. NACI assesses how to use authorized vaccines to achieve the greatest public health benefits. We analyze the spread of COVID-19 in Canada and the risks for population subgroups. We review vaccine safety and effectiveness data from clinical trials and real-world studies, and consider the availability of other vaccines to develop advice on the equitable use of vaccines in immunization programs in Canada. NACI continues to review evidence as it evolves. This is why Canadians should expect NACI to update its guidance as new data become available. We are in a time when new evidence is emerging rapidly. Provinces and territory considered NACI's advice when designing their immunization programs, but the policy decisions rest with them. COVID-19 continues to cause hospitalizations and deaths across Canada, and some jurisdictions are experiencing devastating rates of illness and hospitalizations, straining their healthcare systems. Vaccination is essential to end the COVID-19 pandemic. NACI encourages Canadians to get vaccinated to protect themselves, their families, and their communities from illness, hospitalizations, and death from COVID-19. Canada now has another COVID-19 vaccine available to them. On March 5th, Health Canada authorized Johnson & Johnson's Janssen vaccine for use in individuals 18 years of age and older. NACI's guidance is being issued now as the vaccine becomes available in Canada. The Janssen vaccine is a single-dose viral vector vaccine that can be stored and transported at normal refrigerated temperatures. In clinical trials, the single-dose Janssen vaccine was 67% efficacious in preventing moderate to severe symptomatic COVID-19 infections across all age groups at least 2 weeks after receiving the vaccine. The vaccine was also highly efficacious in preventing critical illness and hospitalization. In addition, preliminary evidence suggests the vaccine offers protection against the B.1.351 variant of concern, first identified in South Africa, and the P2 variant of interest, first identified in Brazil. There is currently no data on the P1 variant of concern, first identified in Brazil. As with the AstraZeneca vaccine, there have been confirmed cases of vaccine-induced immune thrombotic thrombocytopenia, or VIT, after administration of the Janssen vaccine. As of April 23rd, 17 cases have been confirmed following the administration of more than 8 million doses of Janssen vaccine in the United States. The U.S. Advisory Committee on Immunization Practices, NACI's U.S. equivalent, held emergency meetings to review the safety signal and concluded that the benefits of Janssen vaccine outweigh the risk. Similar to the AstraZeneca vaccine, NACI weighed the benefits of the Janssen vaccine in saving lives and protecting populations against serious complications of COVID-19 against the risk of developing VIT. At this time, based on the current evidence, NACI recommends that similar to the AstraZeneca vaccine, the Janssen vaccine may be offered to individuals 30 years of age and older without contraindications if the individual prefers an earlier vaccine rather than waiting for an mRNA vaccine and if the benefits outweigh the risk. This recommendation provides provinces and territories with recommendations on how to optimize the use of the Janssen vaccine in their jurisdictions to achieve the greatest public health benefit. The public health benefit risk analysis for the use of the Janssen vaccine may vary between jurisdictions because of the differing epidemiology. Provinces and territories adapt NACI's recommended age threshold based on their unique circumstances, including local COVID-19 epidemiology, local vaccine supply, and logistics and equity considerations. For example, as a single-dose vaccine, the Janssen vaccine may be better suited for populations that are harder to schedule for a second dose. Health officials can refer to a risk assessment tool in the updated statement to help them determine how to use the Janssen vaccine. NACI continues to preferentially recommend authorized mRNA COVID-19 vaccines due to the excellent protection they provide and because VIT has not been associated with the mRNA vaccines. NACI notes that Canada has procured and is expecting enough mRNA vaccines to fully vaccinate the currently eligible Canadian population before the fall of 2021. NACI has also reinforced its recommendations for vaccination during pregnancy. NACI recommends that a complete vaccine series with a COVID-19 vaccine, preferably an mRNA vaccine, may be offered to pregnant individuals if the benefits outweigh the risks for the individual and the fetus, and if informed consent includes discussion about the evidence of the use of COVID-19 vaccines in this population. A recent study in the United States showed no safety signals of concern following the administration of the mRNA COVID-19 vaccines during pregnancy. In addition, the treatment of VIT during pregnancy, should it occur following vaccination with a viral vector vaccine, can be quite complex. For these reasons, NACI preferentially recommends the use of mRNA vaccines during pregnancy. At this time, NACI also continues to recommend that people previously infected with the SARS-CoV-2 virus be offered a complete series of a COVID-19 vaccine. In the absence of one-dose vaccine effectiveness data in people who were previously infected and limited second-dose safety data, people with previous SARS-CoV-2 infection should continue to receive a complete vaccine series regardless of the severity of their previous infection. NACI will continue to monitor the emerging evidence on this topic and will update our recommendations as needed. For additional information on NACI's updated recommendations, including the evidence and rationales behind the recommendations, please visit the NACI webpage. In closing, I would like to highlight that NACI continues to review evidence and data on COVID-19 and COVID-19 vaccines as it becomes available. We will continue to update our recommendations on the use of COVID-19 vaccines in Canada as needed. Thank you for your time, and I'm going to pass you over now to Dr. Quashtan.
Alors, bonjour. Good afternoon. I'm pleased to be here today with my colleagues to give you two important updates on the use of vaccine to fight COVID-19. NACI is an independent group of experts which provides advice on scientific data. It assesses vaccines in order to get the greatest public health benefits. Apart from clinical trials, NACI assesses the efficacy of vaccines, and it also assesses the efficacy of other vaccines in order to make recommendations with regard to vaccine programs. NACI is continually reviewing data, and so Canadians can expect it to update its recommendations as new data comes in. Provinces and territories take NACI's advice into account, but any vaccine programs are decided by the provinces and territories. Some provinces have very high illness and hospitalization rates, which is putting great pressure on the hospital system. On March 5, 2021, Health Canada authorized the Janssen COVID-19 viral vector vaccine for individuals 18 years of age and older. This vaccine will soon be available in Canada. Therefore, NACI is making its recommendations today. The Janssen is a viral vector single-dose vaccine, which can be transported at the usual cold temperatures. This vaccine is effective up to 67% to prevent moderate to severe COVID symptoms in all age groups at least 2 weeks after administration of the vaccine. It was also effective in preventing serious illnesses and hospitalizations. Further, preliminary data suggest that this vaccine helps protect against B.1.351, the variant first identified in South Africa, and the P2 variant of interest first identified in Brazil. There's currently no data on the P1 variant of concern, which was also first identified in Brazil. As with the AstraZeneca vaccine, there have been confirmed reports of vaccine-induced immune thrombotic thrombocytopenia, or VIT, after administration of the Janssen vaccine. As of April 23rd, 17 cases were confirmed after administration of over 8 million doses of the Janssen vaccine in the U.S. The American Institute held emergency meetings to look into any adverse issues and concluded that the Janssen vaccine has more benefits than drawbacks. We have also concluded that the Janssen vaccine has brought down hospitalizations and adverse effects of COVID-19. Currently, given the data we now have, we recommend Janssen be administered as with AstraZeneca to people aged 30 and more. If a person wants to be vaccinated earlier rather than waiting for an mRNA messenger vaccine, this recommendation provides territories and provinces with guidance on how to optimize the use of the Janssen vaccine to achieve the greatest public health benefit. The risk analysis to public health for Janssen can vary depending on the place, so provinces and territories can adapt the age limit depending on their particular situation, including local COVID-19 epidemiology, local vaccine supply, and logistics, and equity considerations. The Janssen vaccine is a unique dose vaccine, so it might be better to administer it to populations where it would be challenging to administer a second dose. So NACI continues to preferentially recommend authorized mRNA COVID-19 vaccines due to the excellent protection they provide and the absence of any safety signals of concern. Canada has procured and is expecting enough mRNA vaccines to fully vaccinate the eligible Canadian population before the fall of 2021. NACI also strengthened its recommendation that NACI recommends that a complete vaccine series with a COVID-19 vaccine, preferably with an mRNA vaccine, may be offered to pregnant individuals in the authorized age group if a risk assessment deems that the benefits outweigh the potential risks for the individual, and if informed consent includes discussion about the evidence of the use of COVID-19 vaccines in this population. There have been no adverse effects in the U.S. Following studies on the administration of these vaccines. Further, since any treatment of a vaccine in pregnant persons of a viral vector vaccine, NACI recommends mRNA vaccines be administered to pregnant individuals. NACI also recommends that people previously infected with the SARS-CoV-2 virus be offered a complete series of a COVID-19 vaccine. In the absence of one-dose vaccine effectiveness data in people who were previously infected and limited second-dose safety data, people with previous SARS-CoV-2 infection should continue to receive a complete vaccine series, regardless of the severity of their information. For more information, including scientific data and recommendations, please visit NACI's website. To conclude, NACI will continue to closely monitor evolving data on COVID-19 vaccines and will update its recommendations as needed. Thank you very much. We would now be pleased to answer any questions you might have. Thank you very much.
Questions. Our experts are available to answer questions until 2:45 this afternoon. We ask that you limit yourself to one question and one follow-up question. We will be taking your questions in both official languages. Nous procédons à la séance des questions et réponses.
We will now move to the question and answer sessions. Our experts are available until 2:45. We would ask you to please limit yourselves to one question and one follow-up question.
Thank you. The first question is from Annie Bergeron-Oliver from CTV National News. Please go ahead. Your line is open.
Hi, doctor. Thank you very much for taking my question. A few weeks ago, NACI suggested that mRNA vaccines were superior to AstraZeneca. Now the same recommendation is being made for Johnson & Johnson. With a plentiful supply of mRNA vaccines, based on your recommendation, why should anyone take the Johnson & Johnson vaccine?
Thank you for the question. Depending on how vaccines are being rolled out, some people will need to wait for an mRNA vaccine. That is why NACI has stressed that basically for an individual to choose to be vaccinated with either AstraZeneca or Janssen, they need to make an informed choice as to whether they would prefer to get vaccinated sooner with a Janssen or AstraZeneca vaccine, or wait to receive the mRNA vaccine. And that would be an individual choice. They know that their risk tolerance for an adverse event, and also know their personal situation, how much they may be able to protect themselves using public health measures. And those are all issues that would need to be taken into account when one decides whether to be vaccinated earlier with another vaccine.
And it's Dr. New. Maybe I can add to what Dr. Deek said from a sort of a provincial, maybe public health perspective. As you know, in many parts of the country, we're in the middle of a third wave, and there's lots of cases, and there's admissions to the ICU, and obviously, unfortunately, deaths as well. And so, if you look at it, all of the 4 approved vaccines in Canada, including the Janssen vaccine, have been shown through the trials to be effective in preventing serious consequences, serious illness, and death. And so I think that's something that's taken into account by the provincial program. So you're right, there's lots of issues at play, but at the end of the day, it's another tool in the toolbox. Provinces now have, in a sense, 4 vaccines at their disposal, and certainly taking all that into account, they will obviously use, I think, each of the vaccines to their best advantage in terms of offering it to their populations at risk, taking into account factors like the local epidemiology in different parts of their individual provinces and territories. But as Dr. Deek said as well, at the end of the day, it's also an issue of informed consent that the vaccines offered to individuals, certainly from a provincial perspective, I think is taken into account in terms of offering the best vaccines to individuals, but the individuals themselves have to make an informed choice by having the information in front of them in terms of the risks and benefits.
And as a follow-up, it's just that your recommendation seems to be telling people to take Johnson & Johnson only if they don't want to wait for an mRNA vaccine. Does that not go against all the advice Canadians have been hearing time and time again to take the first vaccine available to them, that the first one you're eligible for is the best vaccine? And who do you believe should be prioritized for this?
So when The recommendations have evolved. When we first provided recommendations again for COVID vaccines in Canada, we did not know about the vaccine safety signal. Now there's been a vaccine safety signal, and we've modified the recommendations accordingly. This adverse event is very rare. But we don't know that we're still learning more about it, and we don't know how common it is. Initially, we thought it was about 1 in a million. As more data has become available, it's still very rare, but now it looks like it's closer to about 1 in 100,000. And that is why we've modified our recommendations and made changes as we learn more information. As Dr. New said, in terms of the risk benefit, that is very much dependent on where one lives and the type of activity one does where one lives. So for instance, if someone's working from home, not really going out in a province or territory where there's not much disease, then they're in a very different situation than somebody that works in, let's say, a manufacturing plant, has difficulty wearing PPE, and in a province that has a very high burden of disease. So the risk benefit is very provincially dependent, as well as group dependent.
And Dr. New, maybe we can just add to what Dr. Deek said. You asked about sort of the possible use or indication of the new Janssen vaccine. As I think in the opening remarks from both Dr. Deeks and Dr. Quash Tan in Francais, certainly the fact that the Janssen vaccine is sort of, with the current product monograph, a one-dose regime. And so with that, I think certainly our counterparts in the provinces and territories are taking that into account. If there are certain key populations that should be vaccinated, and it may be more difficult or challenging to bring them back for that quote second dose, then that's certainly one of the considerations that provincial and territorial authorities are taking into account as they consider the use of the Janssen vaccine in addition to all the other vaccines in their portfolio. Thank you.
Thank you. Operator, next question.
Thank you. The next question, la prochaine question est de Mélanie Marquis de la Presse. À vous la parole.
Merci.
Thank you. My question is for Dr. Quash with regard to the 300,000 doses which arrived in Canada last week, but they were put on ice, so to speak. Can you tell us about that? Are you studying that situation, or does this fall under the purview of Health Canada? Well, that falls under Health Canada's purview. As it now stands, Health Canada is finalizing the assessment of the manufacturing plant. There are still criteria to be fulfilled by the plant. As long as the investigation is not finished, the vaccines will not be made available, but NACI is not involved in that part of the assessment. Thank you. Dr. New here. I can confirm what my colleague just said. Yes, that falls under the mandate of our colleagues at Health Canada. They are actually working closely with the U.S. Food and Drug Administration. They are investigating. They are they're trying to make sure that good manufacturers are being applied at the plant. So we are impatiently waiting for the results of that investigation. In that case, my follow-up question is for Dr. New. On Friday, we learned late that distribution has been blocked. When did Health Canada learn about these potential manufacturing issues at the plant, which has had such issues in the past already, and which have been reported by the New York Times at the beginning of April? I can't give you details on the exact date, but as far as I understand, Health Canada received information, but it was not clear that the Janssen vaccine was involved at the plant which had these issues. There might be an issue with an ingredient that goes into the Janssen vaccine, and so Health Canada is working closely with the manufacturer and also with the Food and Drug Administration to analyze exactly what went on in the manufacturing of the Janssen vaccine. Once we have the answer to those questions, we can give you more information, but as it now stands, this is where things are at. Thank you.
Merci. Operator, next question, please.
Thank you. The next question is from David Akin from Global News. Please go ahead.
Well, thanks very much. Maybe Dr. New, I could just have you perhaps provide an update on the release on Friday night about the holding back of the current shipment of the Johnson & Johnson, the Janssen vaccine. Could you give us an update on what was the problem with that particular shipment and where we stand today on getting those doses into the country?
Thank you very much for the question. So just to sort of put it at a sort of a high level, not to get to all of the minute details. Certainly, what I would say is that Health Canada, with the initial approval of the Janssen vaccine, that was based on obviously clinical trial data and other information to look at the efficacy and the safety of the vaccine. So that's one issue. But another part of what they do in terms of their due diligence for approval is also look at the actual sort of quality assurance for the actual production of the vaccine, involving individual factories, and that's the situation in this case. And so Health Canada was informed and became aware that a specific facility, obviously, is, we all know, the emergent facility that was involved in the fact that I think one of the ingredients that's actually used in the production of this vaccine did come from that facility, and therefore Health Canada has been working very closely with their counterparts in the Food and Drug Administration, as well as with the manufacturer, to get more information, more details, to actually assure themselves from a quality assurance process that there is or isn't an issue or a risk or problem with that specific ingredient that was sourced from that a specific facility, and how that obviously was used in the production of the vaccine. And that's why the vaccine is sort of in a holding pattern. It's certainly it's sort of being held in freezers in good condition, and until obviously Health Canada does its due diligence. And I can't give a timeline. I would leave that to Health Canada, but I think I think we can all appreciate they want to do a good, thorough job as quickly as possible. That if there is not a problem, that they can obviously release the vaccine to be distributed as soon as possible. Thank you.
Thanks for that. And follow up, I guess, for Dr. Deeks and for Nancy. There isn't any changes today about dose intervals. And I'm wondering, though, if this is an area of discussion right now for Nancy, given that just not a couple hours ago, the president of the Canadian Cardiology Society was in front of the Health Committee, the Commons Health Committee, saying for healthcare workers, other vulnerable workers, a 16-week interval between two mRNA doses does not provide the kind of protection that healthcare workers, in this individual's view, ought to get. I'm wondering if you have some thoughts about, now that we're getting 2 million doses of Pfizer a week for the next 4 weeks, whether or not it is time, in fact, to recommend changing the dose interval back towards something that the manufacturer recommends.
Thanks for the question. In terms of the interval, I just want to clarify what we've always indicated up to 4 months. And in fact, I would suggest, given our third wave and what is being experienced across the country, trying to ensure that the majority of Canadians get their first dose fast has actually really kept us in good standing in the third wave. That is still the priority, to ensure that Canadians get a first dose of AstraZeneca vaccine, or sorry, not AstraZeneca vaccine, of COVID-19 vaccines. In terms of the efficiency with which provinces and territories are rolling this out, as soon as individuals get their first dose, then there would be an ability for second doses. Certain jurisdictions have made some modifications and changes in their policy and are giving certain groups earlier second doses, but those policy decisions are really resting with the provinces and territories. We're on track to have most Canadians receive their first dose in June. And as we said, there's enough mRNA vaccines for Canadians to be fully vaccinated by the fall. Thanks.
Thank you. Operator, next question, please.
Thank you. La prochaine question est de Catherine Lévesque de la Presse canadienne. À vous la parole.
Oui, bonjour.
Good afternoon to all of you. Before I ask my questions, I would ask all questions to be asked. I know that you have until 2:45, but we did start late. So my first question is for Dr. Quash. As far as I understand, NACI made its recommendations today about the Janssen vaccine because distribution was supposed to start to the provinces, but on Friday we all saw what happened. Health Canada stopped the distribution because of an ingredient issue in the vaccine. So why are you going ahead with the recommendations anyhow today? Why did you not wait for Health Canada to authorize the distribution of the vaccine? Answer. Well, we expect distribution to happen in the next 1 or 2 weeks, and the data should be fairly stable by then. The only reason, in fact, we could have made the recommendations earlier, but the main reason why we tried to make these recommendations as close as possible to distribution is because we wanted to get as much information as possible on potential complications related to vaccine-induced thrombotic thrombocytopenia. The reason why we are making our recommendations today is because we were waiting for recommendations from the Americans, and what might change in the next few weeks is to see if there will be any more reactions to the vaccine in the next 1 or 2 weeks. We're choosing to do at this point. We don't expect many changes in the next 2 weeks. But if Health Canada decides to delay distribution of the vaccine for another 2 months, and that's just potentially a far-fetched example, we would reassess our recommendation, but we believe today is the good day to make these recommendations. Thank you very much. And follow up on the question posed by my colleague from CTV. Why does NACI today insist on the fact that the mRNA vaccines are more effective than the viral vector vaccines? That seems to be a contradiction with what we've heard before, especially with regard to the certain issues related to trust issues related to the AstraZeneca vaccine. So why did you say that in your speech, in your presentation? From the outset, we said that mRNA vaccines are preferable to the viral vector vaccines. I would say that it's not so much a matter of efficacy on the ground, but with regard to the degree of cases, the degree of an outbreak in an area. If you were in an area with a high degree of contagion, would you really want to wait another 2 weeks to get an mRNA vaccine? So the issue is, how would you manage the risk getting a vaccine earlier, even if it's a viral vector vaccine, versus waiting for the mRNA vaccine? Clearly, young people are not as much at risk, so they will wait a bit longer to get their vaccine. The risk of a thrombotic event is not related to the type of vaccine you receive, but there is a higher risk of an adverse effect if you actually get COVID. If you are in a region where there is a lot of COVID, it's worth getting vaccinated earlier to get protection earlier. But we had to be very transparent in our communications. Last week, when there was a death following administration of the AstraZeneca vaccine, we clearly explained our recommendation. We said that viral vector vaccines have a very rare risk of adverse effect, but it is there, a risk of a thrombotic event with potentially lethal consequences. So that's the message we've been saying from the outset.
Merci. Operator, next question.
Thank you. The next question is from Rafi Boudjikanian from CBC News. Please go ahead.
Thanks for that. I just want to go back to some of what you have said about mRNA vaccines being the preferential option. Can you just tell us, are you now saying don't take the first vaccine that's offered, wait for the one you want?
So what we're saying is that, and what we've said all along, is that the mRNA vaccines are the preferred vaccine. And yet, given the epidemiology, the viral vector vaccines are very effective vaccines, but there is a safety signal, a safety risk, as Dr. Quashtan just explained. And the issue with the safety signal is that although it's very rare, it is very serious. And so individuals need to have an informed choice to be vaccinated with the first vaccine that's available or to wait for an mRNA vaccine. They need to be aware that those are the options available to them.
Okay, thanks. And as a follow-up, I just want to return to the question of those 300,000 doses. Why was the public only told Friday evening about the issues connected to the Baltimore plant?
That's a Health Canada issue, so I'll refer that to Dr. New.
Yeah. It's Dr. New. I can't really speak for Health Canada. I think they certainly were doing their due diligence in terms of getting the information with respect to what was happening at that plant, with respect to a specific ingredient involved. There's obviously some preliminary work that needs to be done in terms of getting the right information, the right data, to be able to then communicate that, as you said, to Canadians in an open, transparent manner. So that certainly is what I understand has happened. They didn't have a sort of an early indication beforehand until it came to light. I think probably with respect to discussions they've been having with the FDA and others, because I think it was the FDA that first brought to light some of the issues in terms of quality assurance at this plant, and then by doing some further sort of investigative work, it became apparent that a key ingredient in the vaccine for this particular shipment of doses to Canada was potentially involved. And that's why Health Canada is doing its work, its homework, working with the FDA and the manufacturer. And that's why they put out that notice, as you said, on Friday.
Thank you. Operator, next question, please.
Thank you. The next question is from Mia Rapson from the Canadian Press. Please go ahead.
Yeah, I'm wondering, just sort of following up on this idea that you're not saying that the effectiveness of AstraZeneca or Johnson & Johnson is necessarily worse, but that it's just because they have this safety signal. There are now about 2 million Canadians who have been given this AstraZeneca vaccine and are hearing this and thinking, well, did we get duped into taking this vaccine? What do you say to those 2 million people who now are sitting there wondering if they should not have gotten this vaccine or whether they should even get the second dose of it?
So I would say to them that they have been offered a effective vaccine. We communicated. We've been very consistent in terms of our messaging at through NACI that that vaccines, all COVID vaccines, are safe and effective. Individuals that have received an AstraZeneca vaccine and are worried should be vigilant for the symptoms, particularly if it's within 1 to 3 weeks after receiving a vaccine. They need to be aware of the signal, and if they get any of the symptoms, such as severe headache, they should seek care immediately. After that point in time, after about 3 or 4 weeks, there is absolutely nothing to worry about in terms of having VIT. In terms of the second dose, what is happening right now is we, as a committee, are looking at options for mixed schedules. As of now, though, there is no reason for people to not receive a second dose of AstraZeneca vaccine or mRNA vaccine. And NACI will be making a recommendation about mixed schedules as soon as we see some information from some studies that are looking at specifically at mixed schedules.
Thank you. And I'm just to follow up also on the idea of the delayed second doses, is NACI doing any further study or work on data on whether or not delaying the second dose is a good idea or not? I mean, I hear from lots of different groups sort of lobbying that they should get the second dose earlier. I'm just wondering if there's any studies forthcoming that NACI will be changing its recommendations based on, or if that issue is done as far as you're concerned.
So we don't do studies as a committee. We review the results of studies, but absolutely we continue to get presentations and synthesis of literature that is looking at effectiveness of one dose, and as well as effectiveness of 2 doses. I agree. We are hearing as well. Particularly from my provincial hat as opposed to my NACI hat, from groups that are feeling that they should be an exception to the rule. And, you know, I think one thing to keep in mind is that for certain subsets, like subpopulations, we actually don't have information about how effective 2 doses of a vaccine of COVID-19 vaccines are. So that would include people with immunodeficiencies or people suffering from cancer. And so obviously every Canadian needs to have a full series of COVID-19 vaccines, so 2 doses for most vaccines other than the Janssen product. But importantly, the group, it's just as important for people with immunodeficiencies that everybody around them gets vaccinated. So if they don't respond, whether it's to 1 dose or 2 doses, the population around them is vaccinated. So there's many advantages to ensuring the most number of people are vaccinated as quickly as possible. But we do keep looking at the data. Thanks.
And Matthew Tunis here, Executive Secretary for NACI from the Public Health Agency of Canada. Just to add to Dr. Deeks's remarks, we know that many provinces and territories are actually doing real-time vaccine effectiveness monitoring, including monitoring of this first dose so far. And so, as Dr. Deeks mentioned, and we're facilitating that information to come forward to the committees so that they can continue monitoring, continue seeing how well individuals are being protected over time with that first dose. So it is something that's being very actively monitored not only at this national level as we see the information come up, but also at the provincial territorial level. They're doing, in many cases, weekly monitoring to keep a close check on how that first dose rollout and effectiveness is progressing. Thanks.
Thank you very much. This is all the time that we have today for today's technical briefing. Any additional questions can be directed to Public Health Agency of Canada Media Relations at 613-957-2983 or by email at hc.media.sc@canada.ca. Merci, la séance est maintenant terminée. Si vous avez d'autres questions, n'hésitez pas à communiquer avec le Bureau de relations avec les médias à l'Agence de la santé publique Canada au 613-957-2983 ou par courriel à hc.media.ac@canada.ca. Merci beaucoup.
Thank you. Merci. The conference has now ended. Please